Clarifix is a specially designed tool for applying cryotherapy in a specific area in the nose. So the device made by the company Stryker is shaped so that it can be inserted into an area in the nose known as the middle meatus. So what it's trying to do is use the very cold temperature of liquid nitrogen to stop the functioning of a specific nerve. And that nerve is called the posterior nasal nerve. And the reason why that nerve is targeted is because we know from various studies that this is the nerve that stimulates the nose to produce inflammation and therefore mucus discharge as well as swelling. So if we can somehow turn that nerve off, then it can solve some of those problems. The designers of the device have looked at the effects of cryotherapy at the temperature of liquid nitrogen on the nerve, and they've shown that this can cause the nerve to stop functioning, but importantly also it doesn't harm surrounding structures, and in particular blood vessels which are nearby. So it provides a very focused, localized cryotherapy ablative effect on the posterior nasal nerve, and it's safe. And this is a technique that I have become relatively experienced using over the last couple of years. Clarifix is effective, certainly in my experience and my opinion, in treating patients with persistent nasal discharge, which doesn't respond to normal treatments. So the patients classically talk about a drip from the front of the nose, but also from the back of the nose down into the throat. So my job as the practitioner is to identify that the nasal dripping is the primary cause of the patient's symptoms. And this can be a little challenging when it's down the back. So when dripping is coming out of the front of the nose, then it's clear to see. If it's going down the back, then it's not always quite so obvious. And some patients say to me, I have a buildup of fluid in my throat, therefore it must be coming from my nose. But we know from experience this is not always the case. So certainly, if correctly identified, then that's the kind of patient who would be a good candidate for Clarifix. The other possible candidates are patients with nasal blockage, because the cryotherapy of Clarifix does reduce the general inflammatory stimulus to the nose. And so it should reduce swelling. And so if a patient complains of congestion, then Clarifix can help with that. And there are studies from the United States which show, certainly up to a year, that Clarifix can help both with the dripping and the congested feelings, and that effect is maintained. Now, I'm sure the effect is maintained for much longer than a year, but we don't yet have the data to back that up. And another useful way to try to work out which patients are going to benefit is there is a particular medicine often used for asthma patients called ipratropium bromide. It comes in a nasal spray as well as for asthmatics to breathe in, and there are various products that supply it for the nose. And the main job or the main effect of this ipratropium bromide is to dry up the nose. Now, if it does work in a patient with nasal drip, then that is a good sign that Clarifix is more likely to be effective. So the patient would then, of course, have the option of carrying on with the ipratropium bromide spray, but it does mean they would then have to take it indefinitely. So I often ask my patients to try it just to see what happens. If they don't respond to it, it doesn't necessarily mean that Clarifix won't help them, but it's just another effective way to try to understand if they are the right patient for Clarifix or not. The Clarifix procedure is done almost always under local anesthetic. It's very well tolerated and only takes about 20 minutes to do. So the way I do it is I bring the patient into my outpatient room. Usually beforehand, I've given them a strong painkiller um, because the issue with pain is actually not during the procedure, but sometimes afterwards there can be an issue with pain. But apart from that, they come into my room. I spray their nose with a local anesthetic spray, and I then use a very fine needle to inject a local anesthetic into the exact area where the Clarifix device is going to go. The numbing just takes a few seconds to occur. And then I place the actual Clarifix device inside the nose. And I'm using an endoscope so I can see exactly where I'm going. And then the device is held in position for 30 seconds whilst it's actually on, deploying the liquid nitrogen. I then turn off the valve so the liquid nitrogen stops, wait for another 45 seconds so that the nose can effectively thaw out and warm up again, and then remove the device, and then that's it for one side. And almost always I do both sides because the issue with the patient will always be on both sides. So the whole thing doesn't take very long. I always warn the patients that the nose will get irritated immediately after the surgery, so they should use saltwater washes to help keep the nose clean. And usually for the first 2 or 3 weeks, they don't feel very much benefit, but then once the nose settles down, the effects of the Clarifix can become evident. If a patient sees me with chronic rhinitis, then it's up to me to try to work out the cause. And there are a huge number of causes, from allergies to medicines that they're taking. Sometimes there is an element of sinusitis, which is contributing to it. Occasionally, there's occupational exposure. So if they work in a very cold environment or a very hot environment, or there are chemicals that the patient's exposed to, all of these things can contribute to rhinitis. So treatment is very much tailored to what the cause is. Now, if those treatments have not been effective, that's often when Clarifix comes into play. That doesn't necessarily mean it's always going to work. But one of the big advantages, even if you might say that Clarifix is equivalent to drying up somebody's nose or reducing congestion, it's a one-off application of the device, and then hopefully the patient won't need the medication thereafter. So it's a very attractive proposition for many people. I think it's worth also knowing that the effect of Clarifix isn't always complete resolution of symptoms, but certainly improvement. So if a patient says, currently my problem is very bad, and you rate it 9 out of 10 in terms of how bad things are, then Clarifix might bring it down to 4 or 5 out of 10. And that's fine. And then maybe the patient will still take a spray thereafter, but the combination is very effective. So it's all about assessing the patient as a whole, working out what treatments they've had, what investigations they've had, and then coming up with a plan that's agreed between me and the patient as to what's the best way forward. So if considering Clarifix for rhinitis, the things to discuss are what are the reasons why the rhinitis is present? Have the appropriate investigations been carried out? Have the standard treatments been used? Because it's always good, as a general rule, before starting with some intervention, is to try the simpler treatments, and usually that's a combination of nasal saline sprays or rinses, sometimes steroid sprays, the ipratropium bromide spray, which I've mentioned previously, and avoidance of any causative factors, such as allergies, but also occupational exposure. Looking at what medications you're on currently, because sometimes they can also have an effect on causing rhinitis. looking at other medical problems. And so it's really taken that overall holistic view as to your condition. And if the surgeon has taken all this into account, then it's making the decision at that point if Clarifix is the right thing. So I think it's important that people don't say drippy nose equals Clarifix, because unfortunately it's not as simple as that.